Hello, and welcome to the webinar, How to Establish a Purchased Services Program. We're really excited you could join us today, and we have some great content in store. And today we'll be trying something new, inviting participants to participate in polls throughout the webinar so you can benchmark your process with your peers. By way of introductions, my name is Lindsay, and I'm your host today. We're lucky to be joined by two experts from Medpricer's own strategic sourcing department with a combined 20 years of sourcing and category expertise. Anna and Malia have implemented purchase service programs across the country, and they both bring a wealth of knowledge to the topic. And what do I mean by the word program? So rather than tackling one-off projects like contract expiration or bringing a category to RFP, what we really want folks to start thinking about throughout the course of this webinar is how to create an infrastructure to tackle this broad category of operational spend. And so let's talk about why take a programmatic approach in the first place. Hospitals across the country need saving solutions and fast. With rising costs of care coupled with declining reimbursement rates, it's taking a toll on patient care and providers alike. So affordable care can be reached with cost reductions, which can be attained with a program such as this that we'll outline for you today. And over the years, we at Medpricer have come to understand what elements are crucial to running a truly flawless purchase service program. And to celebrate that fact that more and more providers are prioritizing their purchase services spend, in this webinar today, we'll be pulling back the curtains on our very own approach. So with that, I'll turn it over to Anna to kick us off with the first item on our agenda, which is the importance of establishing a support system.
Thanks, Lindsay. So the very first step you want to take when creating a purchase services program is to establish a support system with buy-in and approval from people throughout your organization, including committees. Beyond creating a consensus around process, committees can also serve to help ensure that the needs of each facility are correctly articulated across larger organizations. Malia, what does your experience show here?
Building a strong and supportive team from the top to the bottom is incredibly important to ensure success for any given category. And after this is done, it makes it easier to build out goals and processes. It's really tough to achieve any of those goals without this type of support. So one of the best practices that we advocate with our customers is to take a three-pronged approach by involving the C-suite, executive sponsors, and category stakeholders. Leveraging executive support can help drive decisions from the top down and ensure engagement and participation across departments.
Yeah, executive sponsors are also incredibly valuable to have. So these individuals have a vested interest in a given category and can drive decisions outside the supply chain. Another way to look at this is that they operate as a conduit when negotiations become complicated, as well as advocate for contract improvements in any given category.
And most importantly, stakeholders. Those are the people who work in this category day after day. What areas or departments are impacted by this service? And the involvement of stakeholders at this level, along with their input and feedback, helps vendor selection and contract management be an easy process.
All right, so let's jump into our first poll. Where does the decision-making power lie within your organization? Go ahead and use the pop-up poll to select your response.
So while we're gathering answers, I can share a little bit about the importance of stakeholders. I worked with a large health system a few years ago that was doing a bid for their environmental services, or known as EVS services. One of the main cost drivers in EVS is the FTE count. So how many people do you need on-site cleaning? We had suppliers come in and give presentations to the customer stakeholder group on their proposal, and they walked through the proposed staffing levels. This particular supplier explained as part of their model to reduce FTEs needed was they were going to ask the nursing staff to empty the trash containers in the patient rooms, which obviously is not the best use of their time.
What was the reaction in the room?
To say the least, it was not well received. But luckily, the customer committee had a nursing staff representative involved, not only in these presentations, but throughout the sourcing process. So they were allowed to voice their disagreement with the model, not only directly with the supplier, but with the other committee members as well. If a decision like this had been made without the nurse's input, I mean, it was clear it would have caused a huge issue when trying to implement.
Oh, absolutely. So let's check back in with the poll results. It looks like the majority of our participants have selected all of the above, and that's really great. This is the dream. It shows a well-rounded effort to get feedback and priorities from all levels.
Great. And so now that we know how to establish a support system, it's time to start thinking about objectives. The supply chain adds tremendous value to the sourcing life cycle, but you want to make sure you're not operating in a vacuum, right? So part of including other stakeholders is being able to set the goals for every project. And you'll want to take into account all the nuances for every different category and location.
So in collaboration with your newly appointed support team, ask yourselves, what do you want to accomplish? Do you want to increase savings, achieve on-contract spend compliance, efficiently process expiring contracts? By setting a clear set of objectives and developing KPIs to measure performance, it'll help you guide your sourcing priorities within your own program.
Yeah, that's right. And another factor to consider may include any organization-wide goals set by your executive leadership. Does your organization have savings or contract goals, and how do they come into play with what you're trying to do? When you're setting those objectives, though, don't lose sight on what's most important, and that's total supplier value. While price is a major consideration in any negotiation, other factors to consider when developing an RFP may include things like service level guarantees, favorable legal terms, and really the total cost of ownership for that particular service.
Yeah, purchase services have to be looked at uniquely when determining which supplier is offering the best value. For products, it's a little easier to compare a widget between supplier A and supplier B, but when you're looking at services, the lowest price isn't always the right choice for your organization.
Yeah, that's right. A lot of these agreements have staff on site who may or may not be interacting with patients. A lower cost provider may be able to charge you less because they're paying minimum wage with little to no benefit packages offered, which can lead to a higher turnover rate. So if the supplier is constantly having to try and hire and bring in new people for that service, it can lead to a lot of issues and complaints from patients.
That's a really good point. I've even seen suppliers who weren't awarded a contract because the hospital thought it would reflect poorly on them if the wages were so low. So for any category, you'll want to take a step back and look at the full picture of the service offering to help determine who offers the best value.
All right, and let's transition into another quick poll. When renegotiating contracts, which factors are most important to you?
So while we're gathering answers, I wanted to share an additional thought. There are a lot of opportunities for savings to be had for non-price factors and strengthening contract terms. For example, I was recently evaluating a pest control contract, and our team was able to identify several additional terms for inclusion that spoke directly to savings in other ways than line items. And it included pricing out services that weren't on the contract that would have otherwise needed to be quoted out ad hoc, and also instituting a pest prevention guarantee.
All right, it looks like the results are in, and it's really split mainly between cost savings and contract term improvements. What I found interesting about this is that, inserting KPIs doesn't seem to be a real focus for anyone on the call. One of the main reasons that it may not be looked at as much is you may not know what, key performance indicators are for this category. Where do I even find those? How do I measure them? Why do I even need them? There's a real opportunity with KPIs to improve your overall quality of service. By writing them in, you put more responsibility on the supplier to live up to their service quality.
Yeah, based on our experience, approximately only 20% of purchase services contracts have KPIs with penalties associated written into their agreement. This can be an issue, particularly for those categories that have direct patient interactions. The Joint Commission requires that you are monitoring the service quality for those services, and the best way to do that is through KPIs in the agreement.
80% is a really large number of contracts without KPIs defined. And what that tells us is that there's room on the table to improve the way. And it's not just a quality control measure. If you think about it, without a penalty written in, your quality terms really are just an empty requirement.
So let's talk a little bit about KPIs. We've broken them down on this slide into a few categories: cost, quality, and outcomes. You'll want to consider how KPIs may vary by category.
Yeah, and not to be pessimistic, but you want to think proactively about what could go wrong. So what could impact my ability to hit my budget? And, are there fluctuating expenses, things like that. For something like food nutrition services, for example, you have your patient day rate, which is firm, but then you have these expenses like floor stocks or catering that can fluctuate by day. Are you monitoring those? Who's signing off on catering? I've seen some organizations that have different tiers that would require different levels of sign-off depending on who ordered it and what type of food was served. But it's the supplier's responsibility to track that and make sure you aren't getting hit with an unexpected bill each month.
Yeah, these are the types of critical questions to address across your categories. Furthermore, it's important that you communicate your KPIs to your stakeholders so that they're made aware of the contractual obligations and are given the opportunity to provide qualitative performance feedback for the supply chain to address.
So we've identified our core team and we have a clear idea on what we want to measure. So let's talk about actually building a vetted process. So how do you begin to employ a sourcing strategy when there is so much to manage? An often overlooked component that's really key to developing a purchase services program is to have a single system of record. So that is, one place where all contracts, data, and process info reside.
We've helped supply chain teams that are lean on staff to develop high efficiency programs with the support of contract centralization efforts. But whether your purchasing team is centralized or decentralized, you can most effectively manage contracts when all the documents reside in one place. This just allows for added visibility and transparency.
Right, and so, to add on to that, I once worked with an organization and they were telling me a story of one of their suppliers. It was a small company who just operated locally. When this customer decided that they wanted to take a look at the category and think about sourcing, they naturally went hunting for the contract. No one could find a copy in their organization, which unfortunately is not uncommon. So the next thing is they went and asked the supplier. The supplier said, "Oh yeah, I have a copy of that contract. I keep those in the backseat of my truck." So this organization's contract has been filed away for years in some supplier's car. So this is obviously not going to be your best program management system.
Super secure. So one of the first challenges that you'll run into is, where do I even begin? How can I quickly determine which categories and contracts to focus on? There really is an abundance of purchase service contracts to work on and so little time and resources. So there are a couple of ways to tackle this.
Yeah, one is thinking about setting dollar thresholds for projects to work on. Setting this threshold is going to weed out some of those smaller, less impactful categories. Some organizations I've worked with have dollar thresholds set that determine if something must go out to bid or not. So anything above $100,000 annually, for example, must be RFP'd, and anything under that threshold can either be renegotiated or maybe put on an auto renewal. Malia, you worked at a hospital before. Did you use any of these type of rules during your time there?
We didn't have anything formal. We just focused on the larger spend items.
Yeah, and that's something I hear a lot, which is kind of why another approach may be something what you're seeing on the slide now, which is using a 3-tier system. So tier A is going to be your big spend categories with high impact to your organization. Tier B in the middle, you're going to have some cost savings opportunities, and these agreements, they may be less complex in nature to source. And then you just have, the tail here at tier C, which is where all the smaller spend lies. You may find that your organization may or may not have already identified and worked on those A categories and are managing them well. Example of these may be like your food nutrition services or waste. The next area of opportunity really to focus on is going to be those in the B categories. Anything in tier C could be looked at for what I would say ongoing maintenance, where you're really just checking a box that says, is there a contract? Yes. Is it not expired? Yes.
Another way to use this and to strategize is to use a supplier partner to help you focus on where to start. This can be an analytical tool or a consultant. These companies can provide a unique perspective on what categories they typically see savings with. So they can take a look at your list of contracts that you have upcoming expiration dates and tell you, based on historical data, which ones could likely yield savings and which ones you're better off just extending out.
So after figuring out which categories will serve as your starting point, that transitions us to another core element of a successful purchase services program, and that's employing multiple sourcing strategies. A traditional RFP process may not be right for every situation, especially for some of these smaller contracts.
By asking important questions up front, you can determine if another approach should be employed. Beyond RFPs, consider direct incumbent negotiations or making sure all of the contracts in a given category expire at the same time.
And when you think about it, what would impact your decision to go with a certain strategy? So maybe it's the dollar threshold thing, like I mentioned before. So anything above X amount, you have to put it out to bid. But maybe you have contracts and categories where your stakeholders are happy. Your market research indicates that your contract in price looks pretty competitive. Maybe that's a situation where you're just renegotiating with your incumbent.
Mm-hmm.
That's great. So considering your typical sourcing strategy, let us know, on average, what % of contracts does your team put out to bid?
Well, everyone's providing input. A customer once told me that a hospital they'd worked for had leadership who discouraged the use of RFPs because that individual thought it didn't provide results. Industry standard across the board shows us that this isn't true. Everyone's using RFPs because it allows you to renegotiate pricing and terms. But I'm happy to report that more and more hospitals are implementing sourcing and RFPs into their everyday process.
So it looks like the results are coming in, and less than 20% are going out to bid versus just trying to go back to your incumbent supplier and get a better deal.
This really isn't surprising because when you're dealing with the complexity of everyday purchase services categories, it's really difficult to put your resources into sourcing one of those complex categories. But by creating mechanisms that support the momentum of your sourcing life cycle, like identifying categories of savings and creating guidelines about when and where to use certain sourcing strategies, your supply chain will be positioned to create a larger impact with its initiatives.
So beyond identifying a process to manage your purchase services on an ongoing basis, it's really important to get the resources in place to help you reach success. Most purchase services teams we've encountered are underinvested. So we need to get creative in how we can help provide value without increasing the FTE headcount. So, what mechanisms do you have in place to gather data and move your program forward in terms of people and process?
And I think the concept of timeliness is going to be key here. Building a process that gives the ability to set alerts that serve information in an actionable time frame is really pertinent here. A key resource for information gathering, market intelligence, is benchmarking. Benchmarking for purchase services is so important to utilize market research to understand what the opportunities are. It all ties back to how to decide which categories to go after. You need to make sure you're using the resources wisely and that they're focusing on the best opportunities to improve pricing and service levels.
I just worked with an organization who was looking at bidding out their managed print service agreements. It's a large spend category that really draws a lot of attention given, almost everyone in your organization uses a printer at some point. They decided to have a benchmark report run first before determining how to move forward. And the report came back and actually showed their pricing was competitive given the current market conditions. So instead of wasting their efforts sourcing something that may not yield very much value, they decided to focus on other areas.
So this can be helpful in setting roadmap strategies, lowering costs, and committing people to the right projects at the right time.
You can create and scale sourcing projects through the support of technology. One of the common themes I've seen working with hospitals is the lack of automation for tracking things like contract terms, savings, et cetera. The use of the Excel spreadsheet is one of the most commonly used tools. This creates, a lot of issues given how manual it is.
Definitely. Someone can accidentally delete information, or maybe it becomes corrupted, and then you're running to IT to trying to find a backup version somewhere. The ideal goal should be to create an audit trail from initial request to RFP to the negotiation process, and through to the award of the contract. After that, you can use this transparency to monitor spend activity and reduce off-contract expenses through insights from the analytics. And do you use technology platforms to manage ongoing initiatives?
Technology has really been key, in particular to tracking red lines, but it doesn't always capture the table conversations during, which some of these red lines have occurred. Once I was facilitating a contract negotiation with a hospital partner and their selected supplier, and the supplier tried to go back on a term that they previously agreed to. Thank goodness we had an auditable trail of communication because we actually used an online RFP platform. We had a record of their original response. And so, long story short, the vendor was able to go back and agree to the original, much more competitive term because we had the proof.
Good. Another point is, how do you measure contract compliance? I've seen everything from an informal intent to comply, meaning a facility says, we promise you we won't contract with other people, to the tedious but necessary work of getting AP reports on a monthly basis and comparing spend across vendors for a given category. But having an automated tool that'll show you where rogue spend is, hanging around, will really assist your team in making sure that all of your hard work that you did in putting together a new agreement isn't going to go to waste.
All right, and we'll transition to our last poll of the day. Tell us what your purchase services team looks like if you have one in place.
This will be really interesting to hear what the participants will say. I've seen results across the board in my experience. Anna, what have you seen?
Yeah, I think it's still purchase services is a new area where a lot of people just don't have a dedicated resource to that team. I think one of the things that makes it a little tough to have a team assigned just to it is they, interact and touch so many different areas of a hospital where, maybe a capital team, they have a set group of stakeholders. That's really not the case in purchase services.
Yeah.
So it looks like the poll results are in, and not surprisingly, a lot of teams out there are balancing purchase services with other projects. That makes a lot of sense based on what we've seen. So if you have a team and they're not dedicated to purchase services, it sounds like they're probably handling, capital and consumable categories as well.
Supply chain teams are unlikely to have dedicated people working on purchase services, as we've seen. They're usually handling purchase services in addition to capital or consumable categories. And you'll want to establish and train on some purchase services specific processes, since it's such a unique animal and can't be run down the same path as equipment. For example, an organization may say, I need 50 new hospital beds. Hey, supply chain, go source this for me. So supply chain isn't likely to have isn't likely to monitor expiration dates of agreements because it's a one-time purchase.
Yeah, and we mentioned consumables. A lot of those are likely on GPO agreements today. So they don't even need to be fully sourced at the local level. Unfortunately, the GPO coverage for purchase services is light. So the majority of these categories still need to be contracted locally and involve a high level of stakeholder engagement. Malia, what is your experience in this area?
I worked at a health system that didn't have anyone dedicated to purchase services. It was really thrown in with IT and a few other categories that didn't really lend itself to easy line item pricing negotiations. But when I see more and more hospitals that have entire teams dedicated to sourcing and or purchase services, I really admire the strategy of that leadership in realizing that these are key categories. But even if there isn't a dedicated purchase services team or individual, it's just key to know your strengths and to have a deep pocket of resources for any potential weaknesses.
Just look at the volume of categories listed here on the screen, and this is just a summary. It would be impossible to hire someone with expertise, and even a small percentage of the full list. So one way to optimize the staffing you have is to look at what tools do you have to make routine tasks take less time, so your team can spend more time doing research, analyzing data, and managing the actual sourcing events. Technology plays a big role here, and you just really need to find the right solution for your team.
Another key to having a successful purchase services program is to build your supplier roster. Do you know what local suppliers currently service that category? Ultimately, who you award a contract to will hinge upon your understanding of the capabilities, capacity, and geographic coverage of the supplier pool. When you enrich your supplier roster with new vendors, that can cover greater geographic cover areas or offer additional competitive incentives. You can get better services, better contract terms, and better accountability for the price you pay.
Right. I mean, how do you even find suppliers? Do you have any partners that can provide market research to tell you what the landscape looks like? One of the demands I see a lot is trying to find quality suppliers. So, almost everyone asks for references in an RFP, which we all know these are going to be like their best customers ever.
And even if you ask for a recent account that they may have lost, you'll likely be hearing from a system that moved away from the supplier at no fault of the supplier.
Right.
Maybe it was a political decision. So that raises the question, how do you get honest, reliable feedback?
A good place to start is by simply building in performance feedback element into your program. So at the very least, you are up to date on your current supplier performance. I also really recommend speaking to your peers at industry events. This can be a good chance to get unguarded feedback on competitive suppliers. So in summary, there are so many ways to build an effective purchase services program, and specifics really vary by the needs of each unique health system. However, what makes these programs unique is the infrastructure in which they are built upon. So when used correctly, the 8 elements on this checklist will aid your efforts and help you achieve your cost savings goal.
Whether you're just beginning to address your purchase services spend or looking to scale the success of your existing program, we really encourage you to look to your peers to learn about the challenges and benefits of taking your purchasing lifestyle to the next level.
All right, and if you'd like to learn how Medpricer helps hospitals optimize their contracting potential, feel free to reach out to us. To see a demo of our purchase service solutions, please visit us online at medpricer.com. That's it for today's webinar. We'd really like to thank everyone for your participation and joining today. And again, thank you so much to Anna and Malia for your insights. We'll see everyone next time with the 3rd episode in this webinar series, Best Practices for Benchmarking Purchase Services. Have a good one, everyone.